Hi, my name is Chelsea Barrett and I'm a graduate student at West Texas A&M University. Today I'm going to be showing suturing skills. First, we have a patient that presents to our clinic. He is a 32-year-old male with a laceration to his left forearm done by glass at his work. So first I'm just going to start by injecting 1% lidocaine with epi into the laceration. I would start by injecting this area into the laceration, moving my way outward, making sure that the entire area was anesthetized. And then I would feel the area and just make sure that the patient only felt pressure and not pain. At this point, then I would begin to make the area sterile, so I would want to prep with betadine, starting from the side of the laceration, moving my way outward in a circular motion. Once I've done that, at this time I would don sterile gloves. So these are not sterile gloves, but I would have sterile gloves on at this point. And then I would drape the area, making sure the laceration was left open and exposed, but had the rest of the area completely covered to make this a sterile procedure. And then this is my sterile field as well over here that contains my needle holder, suture, my Adson pickup, and suture scissors. So first, for this procedure, I'm just going to start out with an interrupted stitch first, making sure to load this only 2/3 of the way. And my Adson pickup here. I'm looking at this area. The patient's laceration only affected the epidermis, so the top layer of skin. So we only have to put top layer of stitches. Had this gone all the way to the dermis, then we would need to put deep stitches or vicryl stitches in to the skin area. So there is our interrupted stitch, and now we're going to proceed with a long running stitch to continue to close the laceration site. Picking up the edges, just making sure that they're averted. Over and under. Just going to clip this area. Oops. This will be my last stitch here. The entire laceration is closed. Cutting. All right, now I'm going to show you the area. So at the beginning are my interrupted stitch, and then here is my running stitch. At this point, I would talk to the patient about care afterwards. I'd want to go ahead and just use mastosols and steri to cover the areas and use a pressure bandage, an ACE wrap bandage, just to kind of help cover the area on top, just to kind of be a little reminder for him not to be using his forearm. We'd want for him to limit picking up anything heavier than 10 pounds, doing any strenuous exercise, because we wouldn't want the stitches to pop loose. We'd also want him to avoid getting the site wet. We want the area to stay dry until he comes back for his suture removal. Since this only involved the epidermis layer, the stitches should only have to remain in for 5 to 7 days, so we'll just see him back in 1 week for follow-up to remove the stitches. I would also notify the patient that if he had extreme pain, any redness, extreme tenderness around the site, to please let us know, and an antibiotic such as Keflex may need to be started at this point. Thank you.